Welcome back to the Flex Diet Podcast. I'm your host, Dr. Mike T. Nelson. On this podcast, we talk about all things to increase muscle mass, performance, and improve body composition, and do all of it without destroying your health within a flexible framework. Today, we've got Dr. Masha Makeeva. She is a physician specializing in integrative and regenerative medicine, focusing primarily on hyperbaric oxygen therapy, or commonly known as HBOT, along with other advanced recovery strategies. She initially did her conventional medicine training and then expanded into areas such as cellular health, mitochondrial function, tissue regeneration, and many other things. What I really liked about this conversation was we got down to how hyperbarics might be beneficial for people, what cases you would want to use it in, what are the different parameters, what are some of the pros and some of the cons, things to watch out for. And then we also had a really good discussion about just general metabolic health, especially on the mitochondrial level, and a bunch of other things. So I think even if you don't have a hyperbaric chamber or you're not currently using hyperbaric, I do think you'll still get a lot out of this podcast. And yeah, it was just really fun to chat with her about this topic. And if you want more information from her, we'll put all of her information and content down below, which I'd highly recommend you check out. And if you want more stuff from me and you want to get on to the Daily Fitness Insider newsletter, where 90% of my content goes out to, we'll have a link to that down below. It's free to join and similar content to what you find in this podcast here. So, without further ado, enjoy this conversation about the use of hyperbaric oxygen therapy. Welcome to the podcast. How are you today?
I'm pretty good, thank you. What about you?
Doing good. Doing good. Wanted to talk to you today about hyperbaric therapy, which is becoming, I would say, a little more popular now. I mean, obviously, it's been around for quite some time. What is the main reason you use hyperbaric? Like, if somebody came to you and said, what do you think is like the top benefit to hyperbaric? What would you say if you had to kind of narrow it down and pick one? And obviously there's many different things within that.
I love that question because it always comes down to that one thing, right?
Yeah, because that's what
So,
people want to know. They're like,
yeah.
oh, was it good for this? Is it good for that?
So while hyperbaric therapy can be good for a lot of things because it floods your system with oxygen, and we all need oxygen to perform our daily functions, right? Without oxygen, we'll be dead in about 3 minutes. I think its main benefit is decrease in inflammation. Because
Mm,
when you look across the board, whether it's a chronic disease or just I want to feel better or I want to look better, it's the inflammation that's the main curl pit to not feeling better, not looking better, or not recovering from chronic disease. So it's the best tool to decrease that inflammation.
amazing. I've even struggled with this very simplistic question. How would you explain inflammation to somebody? I know that sounds like on its face value a very simple question, but that's one I've struggled with to give a good explanation.
And it's true because how do you explain probably the most complex yet the most abundant process, right? That's happening
Right.
in our bodies. I would say if you feel that something's off, most likely it's the inflammation. Now,
Mm,
whatever is causing that inflammation, those could be various things from I ran a marathon, so my muscles are inflamed, or I have an autoimmune condition, so inflammation is part of my daily living. Or I didn't sleep well last night, so maybe my brain or my nervous system is inflamed somewhat. But what sort of unites all these situations, I feel off. I want to feel better again. I want to feel normal. I want to feel myself. what I felt maybe a day ago, maybe years ago. And it's the inflammation that's sort of making me feel lousy, not myself, not well, and wanting to maybe fix something.
Awesome.
Now, it's a physiological process. That's just an easy way of explaining it.
Yeah.
Now, it has a little downside because not everyone is sort of in that great connection with their body when they feel right away that something's off. Same when people start doing hyperbaric therapy, some will say, "Oh, I feel amazing after the first session." And others would say, after 20 sessions, I don't feel anything. It's not that hyperbaric is not working for them and it's working for that first person who felt better right away. It's just some people are more sensitive naturally. Some people develop that sensitivity through suffering through a chronic disease when sort of it's a survival mechanism to understand when things are off. So if you don't feel that things are off, it doesn't necessarily mean that there's no inflammation. Pain is inflammation. Mental issues, mood swings is inflammation. Inability to regulate blood sugar creates inflammation, so people get cravings at that feeling of feeling hangry. So actually everything is inflammation. Whenever something's off, and let's be honest, something's off always for most people, right? We're designed that way. It's impossible to feel great and be that perfect human being that some people are trying to sort of portray on social media. So inflammation is always there, and hyperbarics is also always there as a tool to decrease that so people can start feeling better. Whether
Hmm.
it's pain that's caused by inflammation, we'll see the reduction in pain. Whether it's mental health issues that are caused by inflammation in the nervous system and in the brain, we'll see the reduction in that, and for other symptoms as well. So it's a very universal tool that can help almost anyone unless they fall into a small group of people who have contraindications. Then hyperbaric therapy will bring the relief and will bring improvement in the symptoms.
Very cool. Excuse me. Do you use, what do you think about using blood markers or blood work like before or after? Because some people may say, and I agree with your sensitivity thing. Some people are more sensitive, other people are not. And again, I don't think the goal is to make everyone hypersensitive. You may be pushing people to chronic pain, things like that. So that's not really necessarily the direction you want to go. A buddy of mine said you want to be sensitive enough to act. Like you don't want a ton of sensation. You probably don't want any because you can look at the studies of people who have a condition where they don't feel pain. I think all of them are dead by like their late 30s or something. They just are constantly damaging themselves because they don't have that feedback loop. Would doing some type of blood markers be also useful to see what's going on, like high sensitivity CRP, or is that just kind of not quite close enough to what you're actually looking at?
It's a great question because when high sensitivity CRP is up, then we already dealing with a problem. So
Right.
we can sort of, I always like, I'm a naturopathic doctor, so I always
Mm-hmm.
like to catch the problem, before it becomes the problem. So things like interleukin 6, for example, or erythrocyte sedimentation rate, which are also biomarkers for inflammation, that's when the problem is there. And we can certainly measure those. But it comes down to, so people have sort of a limit to how much money they can spend. Do we
Sure.
want to allocate that money to testing, or we want to allocate that money to getting people better? This is a big question when it comes to biomarkers. Actually, what I would look at is something that you are an expert in is HRV,
Mm-hmm.
the breath rate, body temperature. So those metrics that are sort of free because they're available by a wearable device, and see how inflammation reacts to hyperbaric therapy or any other intervention that I'm planning for that particular person. If we're dealing with the diagnosis, then yes, because we want to see how those markers change in a response to the therapy that we're doing. And then I'll probably do the interleukin panel. Definitely, I look at ferritin. When it's high, it's a really good marker for inflammation. I will look at the albumin and other proteins and things like that. I don't like to go too fancy into testing because I think you can catch a lot of things from regular testing, like ferritin and erythrocyte sedimentation rate or CRP and things like that. I don't know.
Yeah.
What do you think? What kind of testing do you use? Do you go like fancy, let's test everything under the sun, or?
Yeah, I guess I've kind of gone all over the spectrum. Like I agree, I use heart rate variability. Those markers you can get daily. You can see what your response is to them. You can see the podcast I did with you on that. We'll link to that. In the past, I would say probably maybe 12 years ago, I thought that if you got more fancy on testing, it would provide you all the answers. And the short answer to that is I was kind of sorely disappointed. I spent way too much money. And when you looked into some of the reliability, repeatability, sensitivity, specificity, all the stuff of some of these brand new testing, and like, hey, where'd your reference range come from? A lot of times they weren't really that robust. And with some stuff from Brian Walsh, Dan Gardner, my buddy Michael Ruscio, and some other people, that I realized, oh my gosh, like on a just a plain, CBC with differential CMP, like some really basic stuff. Like if you really try to understand where those tests come from, how are they done, there's millions of data points on them. You can actually extract a fair amount of pretty good info, just like you said, with ferritin and high sensitivity CRP, with some really basic tests, which I think are overlooked by a lot of practitioners. Even the CBC with differential, a lot of times the with differential part's not even done. Like the test is what, like $35 or something. It's dirt cheap, but most physicians are not necessarily trained to look at it, or they were, and they don't really use it as much. And my pet peeve with not against you, but the functional med spaces, and I think it's getting better, is it used to be, if you come in, it's 5 to 10 grand of testing. We're going to test everything under the sun. And that might be okay. Like if I'm working with a high level athlete who tells me I don't really care that much about money, but if you make me go back to that darn testing center again, I'm going to be pissed at you. Okay, I'm probably going to err and collect more stuff I might not need just to save them time, because time is more important to them than money. But for the vast majority of people, a lot of the fancier tests were, I'd say, not as valid, expensive. And then as you know, if you just test that many things, you're going to find more stuff wrong. And now you have to explain to the person of, what this is, what's going on. Some people are very hypersensitive to, you tested 300 things and 4 of them are a little bit off. And they're like, oh my God, the sky is falling. It's like, nah, just big picture, you're fine. So yeah, so I agree with that. Just basic stuff when you need it. You can get fancier if you have to, and then have some daily markers and things you're looking to see if it's responding.
I agree. I've had people come in with the testing done, and honestly, you're looking at hundreds of pages, and
Oh yeah,
that
they
can
like come in
become
with a stack.
with a stack. And you're just thinking, first of all, they've invested money into that, but also time, because it takes time
Yeah.
to get tested to get results. Now, if you want to use those tests as a marker of progress, then they need to retest at the same lab,
Yep.
because testing at a different lab might give a different result. They're using different ways of different ranges. It becomes confusing to the practitioner and it's overwhelming to the patient. So I always think, let's use 20 tests across the board that we use on every single person, because that gives us a bit of understanding of what's going on. But then if we suspect mold toxicity, for example, maybe we'll do some more extensive testing. If we suspect Lyme, of course, we need to send it to a special lab and get that tested, but not for every single person out there, because then we're just, keep doing the testing and without thinking and connecting the dots. I truly believe that it's the history of a person that gives us the most information, and tests are there to either prove that we're right or prove that we're wrong and we need to dig a little further.
Yeah, I agree. And sometimes there's rough screens you can do that are not 100%, but are non-invasive and very cheap. I just got this from my functional neurologist, so shout out to Dr. Jeremy Schmo here. I think it's a VCS test where you look at color contrast on a screen, and if you fail that test, he's like, then we'll send you for a mold test, which is 3, 4, $500. Like if you pass it, the odds of you having mold are like extremely low because I guess the mold affects those little color sensitive things in the eyes first. So there's some stuff like that you could do as a screening test if you kind of look like you said, you see the symptoms, you think, maybe this is going on, but maybe you'll do that test for I think it's like $20 or something before sending them for a $400 test. If they're positive there, okay, yeah, let's follow up. Let's do kind of more of the air quote gold standard test because we probably need it at this point, to rule it in or rule it out instead of, running all these fancy tests right away just because you think it might be this, or that. So yeah, that's my pet peeve. So
Yeah, definitely on the same page here with you.
awesome. So back to hyperbaric, like for your clinic, like what is the most common thing people come in for? And then I'll talk about a little bit separating, I'd say, normal physiology versus pathology. So the follow-up to that question then is, do you see most of this for kind of performance enhancement, like the betterment of just the general population who may not necessarily have a specific disease? Or are you kind of working on treating more different types of pathologies and diseases and different processes?
So I have quite a unique specialty. What I do, I help people put together, whether they're patients or practitioners, I also work with practitioners on their patients' cases, to put together a hyperbaric protocol to see what this particular person will benefit the most from. Because with hyperbaric therapy, protocols vary. First, you can choose different pressure, different number of sessions, different duration of the session, and different concentration of oxygen. So all these variables can be plugged into a protocol and the protocol will be personalized. So I will consult with people online a lot because not all my clients live in Madrid. I live in Madrid. I'm Canadian. I do live in Spain. It's been 17 years in Spain, but that's another story.
Oh, Spain's beautiful. I love Spain.
Oh, it's amazing. But most of my clients, my patients are from England. I have patients from Australia, from the US, a lot from Canada, and from other countries. If people speak English, we can find the common language. So when I put together those protocols, there are sort of three types of people who reach out. One cohort is probably the biggest is cancer patients.
Hmm.
And I work directly with their oncologists always because we need to have that oncologist on board and they need to be aware that the person is doing hyperbaric. At least that's ideal scenario. A lot of times it's stage 4 cancer, but many times it's stage 1 or stage 2, newly diagnosed. But people start to researching, and hyperbaric, of course, comes up as a supportive therapy a lot. I also work with professional athletes. I think that's where we
Yeah,
coincide,
exactly.
which is a very different cohort of people, but they also need a lot of support because I feel that the demands in professional sports, but also in amateur sports, but more so in professional. So the demands surpass the ability to recover without technology. It's not possible in today's world. The schedule of competitions and trainings and whatnot too demanding. And also I see people from all kinds of different parts of world. Somebody will come in because their child has autism, or I might see a family because the older member just had a stroke, or maybe they had a stroke several years ago and they're looking into different therapies that could help. So different indications, but I should say two main ones are cancer and professional sports.
Awesome. Is there any type of cancers you see more often, or ones that tend to be better responders to hyperbaric than other types of cancer, or is it kind of hard to say?
So solid cancers, solid tumors
Mm.
respond better. Blood cancers, such as leukemia, are not necessarily the best candidates for hyperbaric therapy. It could still be used as a supportive therapy when somebody's undergoing chemotherapy, but most studies out there, and also clinical experience and clinical work show us that hyperbaric is the most useful with solid tumors. So that could be colorectal cancer, breast cancer, or prostate cancer, lung cancer. Unfortunately, we live a time when by 2030, every second person will be diagnosed with cancer in their lifetime,
Oh, that's crazy.
isn't it?
Yeek.
Yet it's a chronic disease that can be managed really well in so many instances. The issue with cancer is that it brings with it a lot of fear and lack of support system and not understanding what to do next. And I think that's the most difficult about cancer diagnosis. So there's got to be a lot of reforms in medical care when it comes to cancer, considering that so many people will get the diagnosis eventually in their lifetime. And also, I truly believe that hyperbaric therapy can play a huge role, because when we look at what hyperbaric can do for cancer patients, it can help prevent radiation injury, but also treat radiation injury. It's
Hmm.
actually an approved indication for radiation injury. It's used with many types of chemotherapy to enhance the effects of chemo and help with quality of life. It's huge in cancer prevention, because it changes the terrain. Hyperbaric therapy acts on mitochondria, right, where we produce the energy, because that's where most of the oxygen will go. So when it optimizes the health of mitochondria, then the whole health and the whole body is optimized. So we're working towards cancer prevention. But of course, every case is unique and we approach it from different angles. But as I said, preferably always working with a team of other practitioners who work on the case. It's a supportive therapy, not first line. I'd like people to understand this well. If somebody has a cancer diagnosis, please explore all options, not just hyperbaric therapy. Hyperbarics will help. It will help to move the needle. It will help a person feel better. It will help them get. I can give you an example. One of my
Yeah.
dear friends, we went to medical school together. She was diagnosed with breast cancer recently, so her breast cancer is quite aggressive. So her form of chemo was really aggressive to shrink the tumor so she could go through the surgery. And out of many patients of that particular oncologist, she was the only one doing hyperbaric therapy. Now, she did, of course, some other interventions like high dose vitamin C and cold therapy to help her deal with neuropathy and things like that. She didn't lose any hair. She
Hmm.
didn't develop any neuropathy. She didn't miss one day of work or other life demands. She has a little child. So she went through 12 weeks of really aggressive chemo without almost no side effects of that chemo. And when I
Hmm.
talked to her, she said, Masha, I'm doing so many things, but I can tell you, hyperbaric is my favorite. And I do believe that it's really making a huge difference in how I feel and how her body deals with chemo. So she's awaiting the surgery. I wish her all the best with that. And she's using hyperbarics to prepare for the surgery, and she'll use it to recover faster from the surgery. So she's a perfect example, and I wish more people had access to this type of therapy.
Oh, that's super interesting. Is the hyperbaric's doing kind of a dual function. It's kind of potentially helping with the cancer therapy, but it might also be helping with the, I guess, sort of the side effects of, chemotherapy, radiation, because granted, they've gotten a lot better, my understanding, with them, but there's still, you're basically using drugs and methods that are trying to not get cells to proliferate, and you're going to have some side effects of hitting healthy cells kind of along the way just because of the treatment. Is hyperbaric kind of helping to decrease some of the cost of that kind of overflow to some of the healthier cells because of the treatment?
I think because it does help with energy production, right? And we need a lot of energy to heal. So it's absolutely essential to have a therapy, whether it's hyperbaric therapy or combination of hyperbaric and red light or pulsed electromagnetic frequencies, because all these therapies work on energy production cycle inside the mitochondria. So what they could do, I mean, you can not every cancer cell can go back to normal cell. Some cases, early stages of cancer, maybe yes, but here we're dealing with a tumor, right? That is poisoning the whole body. So hyperbarics will help to offset that. And I'm just trying to put this in a very simple
Yeah, yeah,
terms,
yeah.
sort of, to get this across the board. So it might help in situations when people are already losing weight due to cachexia of cancer, maybe to put back a little bit of that weight so they can have a little more energy and feel somewhat better. So I should say it would have a lot of impact on side effects of having cancer. Now, with cytotoxic effects of hyperbaric, so the direct tumor killing effects, it's a very special protocol that needs to be done at the integrative oncology clinic, the supervision of the oncologist, and it could be used in combination with other therapies for direct tumor killing effects. So it's being combined with radiation or chemo, or high dose vitamin C, but in a very precise and specific way.
Yeah,
I
and I
don't know
know
if that
we're
answers the question.
no, that's perfect. And I know we're making a lot of broad generalizations because different types of cancer and different treatments and different plans and all that kind of stuff. So no, that's super interesting. Um, Before I ask you about some of the sports performance stuff, um, maybe just review, like you mentioned, some of the parameters with hyperbaric, because I think the people who are not familiar with it, they hear, oh, so and so did hyperbaric and it was amazing, or oh, it didn't do crap for me. And as you know, there's different types of hyperbaric setups, there's different pressure differences, there's different types of oxygen concentrate, there's many different parameters. So it's not like it's just one thing that is done all the time, that's a little bit more complicated. So you can make the argument that maybe they didn't do it long enough, maybe they didn't do the right pressure, maybe the concentration was different, that type of thing. Like, what are some of the, when you're looking at creating a protocol for hyperbaric, like what are some of like the parameters that you have to pay attention to?
So when I create a protocol, I generally first look at the person. I'd like to see where they at in their health journey. What is their diagnosis? What are their symptoms? What is their vitality? Because we can use different pressures. The question is how well or how not well are you going to feel at the particular pressure? I take that into account as well. Then we create a plan based on the goals, on the health goals. We can have very different health goals. Yours might be run a marathon. Mine might be get through the day and do 3 tasks a day without crashing. So those will call for different protocols as well. Then I look into pressure, of course, because pressure is a variable that could be changed. We are under pressure all the time. It's important to understand that. So right now at sea level, I'm under 1 atmosphere of pressure. There's 1 atmosphere above me, right, that exerts pressure, and this is the pressure I'm at. When we go inside a hyperbaric chamber, we increase that pressure, and we can increase it to different setting. We can go to 1.3 atmospheres. That's common. That's usually used in soft chambers. So that's 30% more that I have right now, right? Just sitting here at sea level. I can go to 1.5, which is 50% more, or I can go to 2 atmospheres of pressure, which is 1 atmosphere more plus the one that's already there, hence 2. The effects will be different. The main effect of pressure is the dissolution of oxygen in liquid inside of us. So when we breathe air, just quick physiology 101 for
Yeah, yeah,
those
please.
listening. So when we breathe air, oxygen in the air will go into the bloodstream through gas exchange in the lungs. It will attach to hemoglobin to get to the cells. That's why we measure your hemoglobin when we do the blood test. And remember oxygen saturation from COVID times, which was super popular, and everybody who got sick, the first thing we did, we measured their saturation of oxygen. That's how saturated is that hemoglobin, how many sites are occupied. So each hemoglobin can carry 4 oxygen molecules to the cell. If it's saturated, I cannot get more oxygen in, even if I really wanted to, because the only way it can travel if it binds to hemoglobin. If your hemoglobin is low, you're a little hypoxic. You're not getting enough oxygen. When I get inside the chamber, I no longer need that hemoglobin because the pressure will dissolve gas in liquid. That's law of physics. It will happen in every single person or any creature, right? That is live, that has liquid and that can breathe in oxygen that gets into the chamber. So that oxygen will be dissolved in plasma and it will get to my cells. My cells will uptake the oxygen and they will start to produce energy. The more pressure, the more oxygen gets dissolved. Now, we come to second variable. How long is my hyperbaric session? We want this to be at least 60 minutes, 1 hour,
Hmm.
because we know that that's how long it takes to get enough oxygen to the cell because we only breathe so many times in a minute, right? There's only so much oxygen that can be delivered in a minute. So after 60 minutes, we sort of get enough for all the physiological changes to happen. Then it's very important, and that can vary. And it can vary in a sense that if it's an athlete who just had an important game, and of course, maybe they're excited because they won, but they're also tired. So we'll have them stay in a chamber longer so they can get more oxygen, longer recovery. As opposed to somebody who has fibromyalgia, whose cells are not optimized yet for this much oxygen. So we keep the sessions shorter to 1 hour, sometimes even 50 minutes. That's the difference in the length. And then there's frequency, which is super important. Am I coming to the clinic once a week? I doubt I'm getting any benefits from hyperbarics.
Yeah.
Hyperbarics is a therapy where you need many sessions, and those sessions need to be done frequently enough. So at least 3 a week, or even more, 7 a week sometimes. All these variables will vary. And then how many sessions I need? Will I need 20, 40? How about 60? How about I'm 80 years old or maybe 85? Then I'll need more sessions, because all the repair mechanisms are slower in my body now. I'll get there, but I'll need more steps, to get there. So all these different variables, they go into hyperbaric protocol, and that way it becomes personalized. And then comes the fifth element. How do we incorporate it in everything else that you're already doing? If you're getting IVs, maybe you have a red light therapy panel at home that you use. Maybe you take supplements. I mean, everybody's taking supplements nowadays. Or you do, what about your exercise and your training schedule? How we incorporate it there? What is the timing of the session? Morning, evening, before workouts, after workouts? So there are many things, and that's when I come in and I usually sit down, break it down. And I love putting together those protocols because, every single part moves the, sort of the neighboring parts, and it just moves the needle so much faster.
Yeah. I don't imagine a lot of that is it's just like for I think of me writing programs for clients and athletes. It's a lot of science and principles, but at the end of the day, there is a lot of art that goes into it of, what your experience is. We've done this and done this and done that because, as you know, research studies are amazing and super, super helpful, but they're also very general and they're specific to the population that was done. And then when you're working with an individual, there's a lot of other considerations of what's going on. So I think it sounds like there's a fair amount of art and experience to doing it also at the same time.
Yes, a lot. That's why we call it the science and art of medicine,
Yeah,
because yes, your knowledge, but also a lot of it is intuition, which is a separate topic. I don't think it's intuition. It's the way your brain works. If it's
yeah.
seen the same situation
Subconscious.
X amount of times, then it makes sort of connection and then it tells you what to do. We call it intuition, but it's based on some sort of knowledge, always.
Yeah, I even do that sometimes. I still a lot of times write out old school programs on paper, write everything out, and then if I'm not sure, I don't feel like 100% confident, I'll leave it sit overnight. I'll sleep on it. I'll get up the next day and look at it and then be like, "Oh yeah, I should change this. This is good. That's good." And it's crazy how when you just kind of let your subconscious kind of think about stuff in the background or go do something else, how you come back and look at something, you're like, oh yeah, that thing there.
100%. It's that. And it's good to usually your first thought is the right thought,
Mm-hmm.
but then you need something to back it up, right? And then sometimes I go back and I can change some things. And there's never just one right choice, you know? I believe with medicine, um, we don't have to be that exact all the time because you can get from point A to point B by taking three different routes and they'll take you there.
Yeah, because physiology is also very multi-pathway, multi-redundant. I've often joked that it's associated with every air quote bad engineering word, right? It's multi-redundant, it's chaotic, it's anisotropic, it's all the things that make it hard to figure out. But the pro of all that is there's not just one training program, there's not just one protocol for hyperbarics. There's a lot of things you can do that can still get you to the end result, especially when you start, adding other therapies and things to it.
100%. And you mentioned something very important that I didn't say. I can put together an amazing protocol, but if that person doesn't have access to hyperbaric chamber that
Yep.
goes to 2 atmospheres of pressure, it's useless. So I need to adjust and see if I can work around with the chamber that they have access to, or if I can't, then I have to let them know we need to find the solution for that. That's absolutely also very important.
Yeah. Same thing I do when I write programs. Like one of the big questions I have is it's a constraints led approach. Like how
Mhm.
often do you think you can exercise? What equipment do you have? Where are you going? Like what is your time? Like those are like all the things that give you the constraints that you have to play in. Because if I write something that's 10 hours a week and they're like, dude, I told you I can only do 4 hours, like they could probably do nothing, right? And you're like, just doesn't matter how good that program was, they just can't do it. And that's an unrealistic expectation. So,
Meet people where they are. Mike, I
yeah.
need to move away from the sun.
Yeah, go
You
ahead.
won't believe it. It's the first sunny day in 2 months.
Oh,
We
geez.
it rained for 2 months. I didn't expect that, but I need to close them.
Yeah, all good.
Let's see how I get this done. What's the maybe like that. All right. I also have so many wires here. Now I have it's the hydrogen gas generator. It's the red light therapy and whatnot. So let me see. Okay, that should do it.
Perfect.
Mhm.
What I know, it seems like to me, hyperbarics are becoming more popular in terms of people potentially having a unit in their house What are your thoughts on that? There's obviously, from what I've seen, the kind of the soft shell, which has a limit of how many atmospheres. There's then more of the hard shell version. Obviously, size is a big issue. What are your general, I guess, thoughts on that?
I think it's good because more people can have access to hyperbaric therapy. I think it also calls for stricter regulations.
Yeah. One of my
Uh,
questions I had
and
was safety too, so you can touch on that too if you want.
I will absolutely touch on that because it's so important and I think it's being overlooked a lot. So it used to be that we had two types of chambers, one for clinics that would go to higher atmospheres that would be pressurized with oxygen. A lot of times nowadays, those are not used as much. We try to pressurize with air. That's generally safer and more financially affordable for the clinic as well. So those chambers that were approved for home use would go to 1.3 ATA, but things have changed. Now you can get a chamber that goes to 2.5 atmospheres of pressure for home use.
Hmm.
And the problem there that people who operate that chamber, they do not have knowledge to run it safely. It's by grace of God that nothing major happened, although we had two accidents last
Yeah.
year. Both were in the clinic, they were not at homes, but still, it's serious and it's important. I teach hyperbaric therapy. I run hyperbaric certification courses here. They're in person here in Madrid, and people come from all over Europe. We've had people from Australia, Canada come to learn, but those are the numbers are in tens, maybe 20. I mean, we've had close to 200 people certified, but it's a drop in a bucket of people who use hyperbaric therapy. And things can go wrong because you need to know how to handle pressure and how to handle oxygen. If we could have some form of formal education for everybody who buys a hyperbaric chamber, I think it would be a lot better than the way things are right now. Yet, I do think that chambers should be available for home use. And I'll give you a quick example. Imagine a child on autistic spectrum. It's already very difficult for parents or for caregivers. Now they have to take this child, bring them into clinic, which is a very new environment. Well, they will feel really stressed. Sometimes drive to the clinic is like an hour, then an hour to get back. So it becomes quite a workload for the family. They're less likely to do the frequency and the number of sessions required. It is much easier if they could have the chamber at home. For an athlete, same idea, right? They come home, they shower, they get into the chamber. Recovery, done. Now, what if they have to go to the clinic? It's a different story. Maybe it's already 9 p.m. that they get home from practice. Not convenient. It's the convenience of having it at home. But also clinics are important as well because at the clinic, most likely you have a practitioner who will help with a hyperbaric plan, who will oversee different side effects and things like that. Important. Not just safety. Safety is one thing. It's also side effects. It's a very safe therapy in a sense that if everything's done properly, nothing's going to happen. But there are different side effects to it. If you don't know that you need to equalize ear pressure and you don't do it when the pressure is going up because nobody told you, it's very likely that you can get some form of ear bar trauma, which is completely preventable and avoidable if you know that. But nobody's being told that they need to do it. I cannot begin to, how many emails I get every day of people sending me an email and asking the same question. I did a hyperbaric session at this facility. Today I feel fullness in the ears, or my ear hurts, or I'm not hearing things as well. And I'm saying, did you equalize that pressure? When same way you do on the airplane. Close your
Yeah. Or
nose.
scuba diving.
Scuba diving, you know? Did I have to do that? They asked me. I didn't know I had to do that. And I say, but this is the negligence of the person who provided the hyperbaric therapy because they had to tell them that. Um, that's my pet peeve. If if you
Yeah,
ask.
totally. Awesome. In terms of performance, does if someone has access, let's say, to a hyperbaric, they are doing it in a safe manner, they've been instructed, and let's say they have it at their home, and they want to increase their, we'll just leave it general exercise performance. Does hyperbaric increase exercise performance, or what's called like an ergogenic, or is it kind of more on the recovery side, getting you back to baseline faster, or could it potentially be both?
So when I teach hyperbaric therapy and when we get to sports medicine, I always say hyperbaric therapy can be used in sports medicine for improved performance and recovery. So that answers your question. It can be used for
Perfect.
both, but the protocols will be different. It's the protocol that determines whether a person goes into recovery or we're sort of working on his performance. Generally, shorter sessions, more performance boosting. Longer sessions will send somebody into parasympathetic mode, right? Into recovery mode. So that's more for recovery. That's just a general rule. Now, when we work with a professional athlete, we of course look at their goals at that particular moment. What are the goals? Where they are? Is it either in the game season? Is it off season? Were they injured and they're recovering from an injury? Then we'll concentrate more on recovery or we concentrate more on performance. But I truly believe that to improve performance, you need to look into recovery because performance depends on how well you've recovered from your previous session.
Yeah, I agree with that. Like, even some of the stuff I've done is if an athlete, let's say, has poor recovery, and let's say it's an off-season model, and they might be able to only train maximally three, let's say, maybe 4 days a week. If you can increase their recovery, so i.e., you can get them back to baseline faster, a lot of times I can add a whole another entire session of training, right? And still have a high quality training session. So if you can have more high quality training, you are going to get a better result, right? The caveat there is that the quality of that session has to remain high, because I'm sure, as you've seen, a lot of athletes tend to be very hyper motivated, and they're like, well, I train 7 days a week. It's like, yeah, but maybe only two of those sessions I'd say are very good. The rest is like, yeah, you're doing stuff, but it's not transferring to your sport. You're just kind of digging a bigger hole, where if we could get you to recover better, get you back to baseline, now you could execute higher quality work, which is going to transfer to your actual sport. So things of recovery then become super important at that point.
But with hyperbaric therapy, you can absolutely achieve both. Why? Because when you talk about motivation, well, oxygen, the organ that consumes the most oxygen is the brain, right? So we know then oxygen will affect not only the physical but also the mental health. And I find that it's often overlooked. We always look at VO2 max, we look at muscle growth, all these different metrics, but who's looking into mental health of an athlete? That ability to make a decision, because I think that separates a really good athlete, right? The elite athlete from just a good athlete is that ability to make those decisions in split second, but also they suffer from a lot of depression and anxiety, and all these things are overlooked. So when we send oxygen to the brain, we improve all these things as well. And that translates to a better session, to a better performance during the game, because it works together with their physical form and their physical health.
Yeah, I think that's super interesting. There's even, as I'm sure you're aware, some stuff now on different psychiatric diseases are probably more related to local ATP production, which obviously is highly related to, oxygen and things of that nature, that it's maybe more of lack of a better word, metabolic disorder. Chris Gardner has published some very interesting stuff on that using a ketogenic diet. And yeah, so I think that's a super good point that I think is overlooked a lot.
And it all comes down to the health of mitochondria. I do believe that we are as healthy as our mitochondria. So to assess the overall health, let's look at the health of the mitochondria, because everything that happens to us is a consequence of our metabolic health. What is happening? How we use fuel to make energy, how we use food that we eat. Well, first of all, let's make sure that we eat good food, right?
Yeah.
Nutritionally dense and things like that. So the quality of the fuel has to be good. Then we send it to the factory where we will make energy. Oxygen is the last step of that. What about four other complexes in that chain? Like how optimized is that? And also, I think important point that a lot of people overlook when it comes to hyperbaric therapy or any other therapy that improves the health of mitochondria. Somebody had a session in a hyperbaric chamber. So their amount of energy they produce will go up because there's more oxygen. So it produces energy more efficiently. What are you planning to do with this energy? Use it to heal things, or use it because you're so used to that fast-paced lifestyle that drains health of mitochondria. And that's my biggest issue with the modern lifestyle that we have. We became overachievers. The more, the better. We sort of measure success by the amount of content that we produce and by amount of clients that we have, by amount of money that we make. So it becomes a never ending game where we're trying to chase I don't know what. But the end result that it's the mitochondria that takes that suffers through the process, and it can't keep up, and then we end up with all those metabolic diseases. So with hyperbaric therapy, if you're an athlete or not an athlete, or maybe you have arthritis, or maybe you're recovering from long COVID, anything, take your time and rest. I think that's one of the points that people forget, and that decreases vastly the effectiveness of any therapy out there.
Yeah, that's one thing I've gotten a lot more into the last probably year and a half, I would say, is just any form of down regulation, right? And at this point, I'm like with clients, like it's almost like whatever they can do. And then in a perfect world, I'll move that down regulation methods, which there are many, immediately as close to after their training, right? Probably similar to you mentioned hyperbarics, they become more parasympathetic. So can you get this high output, and then now can we get you back down to baseline faster? So even simple stuff like if you have access to a sauna, do some breathing, even lie on your back with your arms out, legs up. I use the shift wave device a lot, which has been super amazing for a lot of down regulation using pulse pressure waves and some audio scripts and tones and stuff like that. It's been super fun. But it sounds like hyperbaric also serves in that direction where, because of the environment, you're kind of limiting the amount of outside exposures. And you mentioned with longer things that athletes or clients become more parasympathetic, correct?
Athletes become more parasympathetic. We discussed this when you came to my podcast.
Yes.
Well, it's a very interesting discussion. I can tell you it just started this whole thought process in my head where you mentioned that how HRV goes up. I mean, anybody who's interested, I recommend listening to that episode because
Yeah, we'll
Mike
definitely
was
link it in.
absolutely brilliant
Oh,
in
thank you.
how you described that. Because if you send somebody if the parasympathetic mode is too much, that's not a good thing either, right? You need to sort of balance
Yep.
those things. So staying in a hyperbaric chamber for a long time can absolutely do that. Then how do you get to baseline? So you need to use it wisely. Any therapy, including drinking enough water, needs to be used wisely, right? Same with hyperbaric. So just this many minutes in a hyperbaric chamber, then rest for half an hour at least Because when you get out of the chamber, what happens to the oxygen that was sent into your blood, into solution? The pressure is down, so oxygen comes out of the solution. You're
Mm,
flooded with this. So use this 15, 20, 30 minutes for your body to repair. Don't run, don't stress, don't call somebody on the phone and, start, where's your package that didn't arrive? That will, you'll use up a lot of energy that way. Just sit down. And you mentioned, some of that beats and in different light therapies that could be used. Super important. Combine those things wisely without thinking, oh, what else I can do to sort of increase my performance. Because at one point, the body will say no.
yeah. And I think that's a super important point that I think, and this is something I missed too, is that the association is when I'm doing the hyperbaric is where I'm seeing my little air quotes the benefit. But like you mentioned, what you're really doing is you're kind of loading the system, you're saturating it, and then when you go back to that normal atmospheric pressure, that's when you're getting the release of it. So what you do after it is also super important. So my brain goes to, somebody had access to hyperbaric, okay, we could do that, saturate the system, and then maybe stick him like in a shift wave chair for 20 minutes to keep that parasympathetic, keep them relaxed, keep them in that, almost they have a synthetic sleep protocol, like close to sleep, relaxation as their body is becoming saturated with the oxygen at that point.
That would be ideal.
A perfect
That would,
world, right? Which,
yeah.
it's hard to get everyone to do everything all the time. But yeah, and in terms of a ideal situation.
But I think if you explain it well, then people will absolutely agree with that.
Yeah.
Everybody likes to rest. I mean, what you are suggesting is that people take another 15 to 20 minutes to rest, and you explain why that is very beneficial if they just had a hyperbaric session, and then the whole world agrees because it's nice to rest. And then you
Yeah.
feel so well after that.
Amazing. Kind of a out of left field question as we wrap up here. Have you looked at CO2 therapy? So it just so happens I went to my functional neurologist yesterday, Dr. Jeremy Schmo here in Minnesota, and he had a full body CO2 system where they put you in what looks like this kind of rubber suit, like dry suit thing, and then they inflate it with CO2. It turns out CO2 can be absorbed transdermally through the skin. And so I was chatting with him because he does a lot of hyperbaric work for TBI, concussion, things like that at his clinic. And so I was thinking, is there something that almost like I think of contrast therapy where you've got a heat exposure and you've got a cold exposure, you kind of go back and forth. Again, there's pros and cons to that. I think it's a little hard to troubleshoot that to start off with. But any thoughts off the top of your head on the other end of the spectrum, which might be like a CO2 type therapy?
So I think CO2, which is carbon dioxide, falls into the um, realm of how we use gases medically. So hyperbaric therapy, we use pressure and oxygen. There's hydrogen that we can use also a gas. We can use nitrogen in cryo chambers, maybe not necessarily inhaling it, that's not good for you, but at least it's being used. And now we're researching carbon dioxide. I saw some studies, I saw some clinics that are doing that. I think we're at the very early stages
Mm-hmm.
of sort of having protocols and structured information on that, but I think it's very promising from what I've seen. I don't know if it's hot and cold as oxygen and carbon dioxide, but
Yeah,
I
yeah.
both have their place. We just need to find the safe way of administering it and find contraindications, structure it, look at the side effects. Now, who would be the ideal clients and patients for that, and who else could it could be used for, and things like that. But definitely, I think it will be huge at one point, but it takes a lot of time. One thing I find with hydrogen, I'm quite interested. I use
Hmm.
hydrogen generator myself, both for gas and for water. And it's been 15 years, I think, since it's being researched, but it's getting very little traction. Now, maybe a little more, so it will take another 10 years before it becomes as popular as hyperbaric therapy now. Hyperbarics 15 years ago, everybody was thinking I was crazy, you know? Same with CO2, but it's an interesting topic, definitely.
Yeah, even the hydrogen therapy is one of those things I've looked at off and on for, oh God, probably 8 years now. And the first time someone mentioned it to me, I was like, "What are you crazy? I don't know." And then like every other year, I feel like I kind of change my opinion on it. Like some years I'm like, "Oh, it's amazing." Other years I'm like, I don't know. But I would say over time, the more I keep reading, the more I'm kind of like, I think there's probably something there. Again, I'm not 100% up on the literature on that, to be honest, but I think there's something there. I'm not sure what, but I think it's, kind of like where red light therapy was. I started looking at that 10, 11 years ago. And at the time I was like, oh, these weird biohackers, because there was like one or two companies that were making them. And I actually started reading literature on it thinking there's going to be no literature on this. This is just absolute crap. And then I was shocked at, oh my God, like photobiomodulation, there is a absolute ton of research on it. And so now I use a red light therapy probably most days I'm home for last probably 8 years. It's probably one of the rare things I've, still kept in my protocol. So yeah, I think there is something super interesting to both of those areas.
Absolutely. We just need to do more research and maybe start using it more because I guess you learn from practical use. We all do. That's why our clients teach us all these things, really, and their experiences. We start recommending it based on what literature says or what maybe other doctors doing, and then see how people react. And they don't necessarily react the same way as study participants. So it
Yeah.
gets more confusing. And then years go by and it becomes something so widely acceptable, like photobiomodulation, aka red light therapy, right? Where it used to be that it was available in some clinics with, lasers and things like that. Now, almost every household has some form of red light therapy device.
Yeah.
That's how
Last
far
question
we.
as we last question as we wrap up. Is there, if people want to play with hydrogen therapy, is there, what do you would say is a good starting point? I know there's little tablets you stick in your water. There's hydrogen water generators. There's hydrogen air generators. Is there a good starting point you would recommend people kind of look at?
Absolutely. So tablets will be the good starting point.
Okay.
Why? Because it's very little investment comparing to hydrogen gas generator. Tablets are very well researched. They will act on the gut and the liver and improve somewhat the metabolic health. And you will see right away, is this something that's working for me or not? With gas, it's more complicated because the truth is maybe one or two machines on the market really deliver the consistent dose of a hydrogen gas. It's very difficult to assess. So I have several podcasts that I've recorded because I needed to understand this myself. And honestly, you understand things, but you also understand there, that there's something that we know that we know that we don't know, and we don't know that we
Yeah.
don't know. So this is
The unknowns unknowns.
exactly. So this is honestly, we don't know that we don't know this still, but tablets is a very good place to start. Absolutely. It's the only caveat is that you need to understand how to take them. Once you put them in water, there's a very short window until hydrogen evaporates. So
Yeah, it just goes
people
away.
don't get results because they don't follow the instructions. But I do encourage, like, talk to a practitioner, make sure you don't have any contraindications, and that with everything that you want us to, even the nutritional plan needs to be supervised somewhat somewhere. And then
Awesome.
hydrogen tablets definitely a place to start.
Cool. Thank you. I think I'll add that to my list again to play with again when probably this spring when I don't have as many variables going on.
Sounds good.
Awesome. So tell us all about, I know you do protocol recommendations for people. You put out a ton of stuff of content and everything else. So tell us about all of the stuff you got going on.
I teach hyperbaric courses. I do believe in the power of education. When somebody's educated, they're more likely to make the right decision and help other people recover better. I also work with private clients where I help them put together hyperbaric protocols. That's mostly what I do. And I consult with clinics on how to create programs that work. Things like how do you combine hyperbaric oxygen, cryo, red light therapy in one place? How do you put programs together that work? This is a big part of my work and a big passion of mine because I know that I can influence the health of people on a bigger scale.
Mm-hmm.
It's great when you consult with a client, you help one person. When you teach a group of practitioners, you help so many more people. But when you put together a clinic or help put together a clinic that will hopefully see clients and help them improve their health, that's even bigger. I do believe, Mike, I have this thing. I do believe that if the world is a healthier place, it's a much better place. When people are
Oh,
healthy, they're
100%.
kinder to each other. I do believe that we can change this world by just changing physical and mental health. And I hope, I can contribute to that. So if somebody's interested, oh, and I have a podcast. It's a
Mm-hmm.
Hyperbaric podcast. That's how we met.
Yes.
Actually, you were on my podcast where I get to talk to smart people like yourself and ask them questions, and educate myself. And really, I love those conversations. And these are all available on my YouTube or podcast platforms.
Awesome. Yeah, we'll definitely link to all of that stuff. And yeah, I'd highly encourage people if they have hyperbaric questions and things to reach out to you. I'm sure I'll probably have way more questions for you in the future and hopefully be able to send you some people and stuff too, because it's one of those areas I've looked at enough to know I think there's definitely something there, but I am definitely not an expert in any, like, what do you do at that point? I don't know. So it's nice to have other people you can ask questions and send people to and get information and everything too. So yeah, so thank you so much for all that. I really appreciate it. And we'll link to everything down below.
Thanks for having me.
Thank you so much. Appreciate it. Thank you so much for listening to the podcast. Huge thanks to Dr. Masha for all the wonderful information on hyperbaric oxygen therapy and just talking about, good mitochondrial and general health overall. If you want any more information from her, make sure to check out all of her great information at her links and everything down below. I highly recommend that. If you want more information from me, check out my Fitness Insider newsletter link down below. You'll be able to get onto the list for free. And I send you all sorts of great information about improving body composition, improving performance, better body comp also, and doing it without destroying your health in the process. As always, thank you so much for listening to the podcast. Really, really appreciate it. If you have a little bit of time, you can hit the download, the like, the subscribe, all the great stuff that helps us with the old algorithm. If you are on YouTube, again, most of our content goes out via audio channels, but we are trying to put a few more clips and everything else on YouTube. If you could help us out by hitting the old subscribe button there, that makes YouTube nice and happy, which helps us. And if you have even just 30 seconds to leave us a review on iTunes, Spotify, wherever, it goes an extremely long way to helping us get more wonderful content on the podcast. I've got a lot more great episodes coming up. We've got one with a super in-depth dive on breathing with CO2, O2 regulation, breathwork techniques. We've got Dr. Darren Kandow coming on to talk about creatine, Dr. Scott Scher to talk about methylene blue, and a bunch more stuff coming up. So make sure you stay tuned for all of those coming out very soon. So thank you so much for listening to the podcast. We really, really appreciate it. And we'll talk to all of you next week.
Now that's talent. An opera singer who tap dances and sings cowboy songs. I wonder if there's anything she isn't good at.
Yes? Choosing what show to be on.
This podcast is for informational purposes only. The podcast is not intended as a substitute for professional medical advice, diagnosis, or treatment. You should not use the information on the podcast for diagnosing or treating a health problem or disease or prescribing any medication or other treatment. Always seek the advice of your physician or other qualified health provider before taking any medication or nutritional supplement, and with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this or any other podcast. Reliance on the podcast is solely at your own risk. Information provided on the podcast does not create a doctor-patient relationship between you and any of the health professionals affiliated with our podcast. Information and statements regarding dietary supplements are not intended to diagnose, treat, cure, or prevent any disease. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to therein. If you think you have a medical problem, consult a licensed physician.